What I'm discussing now is the use of creams that are designed to remove calluses from your feet. Now we use something called Kera42, which has about 42% uric acid, not salicylic acid. That's more appropriate for warts. But what this is, it's just like any other lotion that you would squeeze and put on your foot. We won't put any on today, but when you wake up in the morning, take your shower, that skin's nice and soft after showering. You can sand that area a little bit with like a pumice stone. We have these here. They're inexpensive. We give those to you half the time when you're doing something like this. So you can sand after you shower, but after you shower, when that skin's still soft and receptive, you put a small amount of that cream on that area. Now this is just for calluses. This is not for your nose because your nose looks dry. This is an acid, so your nose might get a little red like Rudolph, and we don't want that. But it can be used on hands and feet, mainly the bottom. And if you have, for example, really thick fungal nails, sometimes putting this on can soften those, make them easier for you to cut at home. But the most you would use this is twice a day. Most people go to once a day. And then just several times a week, you're doing that sanding after you bathe on those calluses to help keep them at bay. The best way I think about this is kind of like, this is like toothpaste. You know, you brush your teeth every day, twice a day to make sure you don't get cavities and plaque. Do we still get plaque and cavities? Yes, we just get a whole lot less. So this is just keeping the callus thickness down, helping to alleviate that pain, and in a lot of cases make your feet look much nicer at the pool.